Hello, this is Haley Brown. I am in Adult Health 1, Term 2 in Professor Lloyd's class, and today I'm going to be performing a basic IV insertion. So first, what I'm going to do before we go into the patient's room, we're going to take a look at our MAR and verify the physician's orders to make sure it matches up with the correct patient and the correct procedure that wants to be done, in this case the IV insertion. We're going to make sure that we look at our MAR to make sure that the patient doesn't have any allergies or if there's any pertinent lab results that we need to be looking at before the procedure. And then also determine the appropriate size gauge for the procedure. For example, blood transfusion would need a 20 gauge needle. So now that we know what our orders are, we're going to go ahead and go to the med room and collect all the equipment that we would need. We're going to need gloves, tape, angiocath 20 gauge, normal saline, our 10 ml syringe, our extension tubing, tegaderm, and alcohol preps. So the first step I'm going to do is go ahead and prep my normal saline syringe. I'm going to go ahead and draw up 6 ml of air, inject that into my normal saline, and go ahead and draw it back. Okay, we're going to go ahead and take off the blunt tip and prep our INT. And there is good flow, no air bubbles. And we're going to go ahead and kink this and put it back in its protection wrap. Now I'm going to go ahead and I already have prepped my tape into some strips over here, and I believe we're good to go into our room. So I'm going to go ahead and knock on the patient's door, introduce myself. Hi, Mr. Jones. My name is Haley. I'm going to be performing an IV insertion that your doctor has ordered so we could administer IV medications. Could you please tell me your name and date of birth? And I would check that against my MAR and the wristband to make sure that it was the correct patient for the procedure. I would ask Mr. Jones, have you ever had an IV before? And tell me that he has or hasn't, and I could let him know a little bit about the procedure. And I would also verify that Mr. Jones didn't have any allergies before I started. So now I'm going to go ahead and take a look at the arm, and steps that you're going to be looking for the right vein would make sure that you are putting the IV in the non-dominant arm, also or the arm opposite to a renal dialysis shunt or fistula. In this case, this would be the correct arm to use. When we're looking for a vein, we want to make sure that the vein is soft, spongy, and bouncy. You don't want a cord-like vein or a spider vein that's too thin for the gauge needle that you're going to be using. You also want to make sure that your IV site is starting distal, because you work your way up if need be. So I'm going to go ahead and take a look for the good vein. I'm going to apply this tourniquet and have Mr. Jones squeeze his hand a little bit to make sure that we popped up these nice veins, and I do see one that I want. So I'm going to go ahead and put my gloves on. Okay, and we're going to go ahead and alcohol prep the site. We're going to go in a circular motion. And I'm going to go ahead and use this alcohol prep as an indicator of what vein I wanted, just so I don't forget. And I'm going to get my angiocath. Make sure that the bevel is up and that you're holding the skin taut. Mr. Jones, you're going to feel a little stick. I'm going to go at a 15-degree angle. And I see a blood return, so I'm going to go ahead and advance the catheter. And I'm going to hold pressure, and this is going to go into the sharps. We can release that tourniquet from you, Mr. Jones. And now I'm going to go ahead and connect my extension tubing on there, and I can release the pressure. Everything's good now. So to make sure that I was in a good vein, I'm going to go ahead and unclamp my extension clamp. I'm going to aspirate back a little bit to make sure that I get a little blood return, and I do, so I'm going to go ahead and administer 3 mLs. And as I'm giving positive pressure, I'm going to go ahead and clamp, and we can go ahead and take this away. Now I'm going to go ahead and put my Tegaderm on, which I have made sure to do my initials, date, and the size gauge that we used. We're going to make sure that it is placed above the hub, and then peel away. And being careful not to tear our date and time that we have here. And I'm going to also perform a chevron to make sure that it doesn't go anywhere. We're just going to crisscross this like so. Use the other piece. And then as well as we're going to go ahead and bring this back and tape it and give it a little bit of slack so he can move without anything being in the way. And go ahead and put our initials, date, and gauge on there, just so everyone can see out of the way. And since we're finished performing the IV insertion, we're going to ask Mr. Jones, are you comfortable? Is there any pain that you're having? I don't see any redness. The site is clean. And he seems to be okay with it. No uncomfortableness at all. So now we're going to go ahead and I would document which arm we ended up putting the IV in. I would make sure that I put the date and time and the gauge that we used. I would make sure to document any patient teachings that I gave Mr. Jones, and and then how Mr. Jones tolerated it, and then we would be good to go.